Ever wondered about your thyroid blood test results, especially when numbers like TSH come back lower than expected? It can feel a bit confusing, but understanding what a low TSH means is a big step in managing your health. When your thyroid stimulating hormone, or TSH, levels are low, it most commonly indicates that your thyroid gland is producing too much thyroid hormone. This condition is known as hyperthyroidism, meaning your thyroid is overactive. TSH is like the master controller for your thyroid. It is produced by a tiny gland in your brain called the pituitary gland. The pituitary gland constantly monitors the amount of thyroid hormones circulating in your bloodstream. If it detects high levels of thyroid hormones, it naturally reduces its production of TSH, signaling your thyroid to slow down. So, a low TSH level is essentially your pituitary gland's way of saying, "Whoa, thyroid, you are working overtime." Several factors can cause your thyroid gland to become overactive and lead to low TSH. The most common cause is Graves' disease, an autoimmune condition where your immune system mistakenly attacks your thyroid, causing it to produce excess hormones. Other reasons include toxic nodular goiter, where one or more nodules on your thyroid gland produce too much hormone, and thyroiditis, which is inflammation of the thyroid that can temporarily releases stored hormones. Sometimes, taking too much thyroid hormone medication for an underactive thyroid can also lead to low TSH levels. In rare cases, a problem with the pituitary gland itself, known as central hypothyroidism, can cause low TSH, but this often presents with other hormonal imbalances. If your TSH levels are low, the next step is usually to consult with your doctor for further evaluation. They will likely order additional blood tests, such as free T3 and free T4, to confirm hyperthyroidism and help pinpoint the exact cause. Your doctor might also conduct a physical examination and discuss your symptoms and medical history. Imaging tests, like a thyroid ultrasound or a radioactive iodine uptake scan, may be used to identify conditions like Graves' disease or toxic nodules. Knowing that a low TSH often points to an overactive thyroid, and understanding the potential underlying conditions like Graves' disease or toxic goiter, empowers you to have a more informed discussion with your healthcare provider. This insight helps your doctor create a personalized management plan, focusing on balancing your thyroid hormones and alleviating any symptoms you might be experiencing. It is all about working together for your best health.